You know, there seems to be a new study that comes out twice a year saying alcohol in moderation isn't harmful. Maybe a glass of wine a day is actually good for you. Then after, a new study comes out saying you need to avoid alcohol altogether. All right, let's get to the bottom of this glass. Let's bring in Kaiser Permanente cardiologist, Dr. Dipika Gopal. So is there a changing view on alcohol, doctor? Anyway, outside of any studies, does it seem like people are drinking less anyway?
Thank you so much for having me here today. It is true that over time, especially since the pandemic, we've seen a decrease in alcohol consumption and an overall understanding that there are some negative effects. There are many negative effects to alcohol and the overall push to reduce the level of alcohol consumption.
So how does alcohol affect your heart? I mean, you're a cardiologist, you would know.
Absolutely. Alcohol can have negative effects on the heart in terms of the heart rhythm abnormalities. It can lead to worsening heart muscle and lead to heart failure. Can also worsen other conditions like coronary artery disease.
For people taking medication, and a lot of people are on a daily something or another, even if it's aspirin or Tylenol, how does alcohol work with that?
So alcohol can affect metabolism of many medications, as both alcohol and many medications are metabolized by the liver. So there's that common denominator there that we want to keep healthy, which alcohol can damage.
So what would be a sign that you might be having a heart issue, whether it's alcohol related or not?
Sure, there's a variety of different symptoms that you could have from a heart condition, but most worrisome would be chest pressure, chest pain, excessive shortness of breath, not being able to do the activities that you were able to do before. Better to seek care from your doctor and try to figure out, is it the heart, is it something else, and move forward from there.
That bottom of the screen, atrial fibrillation, is that when we're getting into some serious issues?
Atrial fibrillation can be triggered by alcohol consumption.
Okay.
Alcohol consumption is a big trigger for that. So,
all right, let's go to the beginning when we first started talking. Can you have a glass of red or white wine? What's the least offensive alcohol? If somebody's going to have something, what should they drink that's the least damaging?
You know, that's a great question. I think the biggest message here is that any alcohol you drink can be harmful for you. And so if you're not drinking any alcohol, don't start drinking alcohol for a potential benefit. And if you are drinking alcohol, reduce it as much as possible.
So let's say you diagnose that I have some issues. What would be the first steps we would take? I mean, blood work, is that the first thing that I would bring to you? And you look at my blood work and say, okay, we need to do more tests?
You know, it depends on what kind of symptoms you're having. From a heart disease standpoint, alcohol can affect you in terms of your heart muscle. So sometimes you may be ordered blood tests, sometimes imaging tests. It really depends on what symptoms you're having.
So you're not giving anybody a pass here that wants to have a glass or two. Is it just don't do it if you can avoid it?
Studies show that there really is no good benefit for alcohol.
All right. Dr. Gopal, thank you for joining us today. Appreciate it.
Thank you for having me.